Good morning. I call this meeting to order. At this time, I would like to take a moment to acknowledge that we have a new clerk for the Women's Health Commission. Zoe has departed from the county, and Audrey, can you help me pronounce your last name, please?
Buckholtz.
Thank you. Buchholz will be supporting the commission as the clerk going forward. I want to take a moment to thank Zoe for her support of this commission and wish her well in her next endeavors. Will the clerk please call the roll?
County Executive Chris Ronayne.
Here.
Dr. Lauren Bean. Heather Brissett.
Here.
County Councilwoman Yvonne Conwell. Emily Campbell.
Here.
Dr. Melanie Golembiewski.
Here.
Councilwoman Tennille Kaus.
Here.
Jasmine Long.
Here.
Dr. Connie Moreland.
Here.
Chris Murray.
Here.
Councilwoman Nikisha Nickerson. Councilwoman Jasmine Santana. And Mayor Kim Thomas.
Here.
Thank you.
And just a reminder to my colleagues, please remember to press the button and speak directly in the mic so we can ensure everyone can hear us on live stream this morning. Thank you. Before we proceed, I would like to call for a moment of silence and reflection in recognition of all the contributions and challenges faced by women across the world. Thank you. The next item on our agenda is the approval of prior meeting minutes. These minutes were circulated to the commission prior to the meeting this morning. I now invite members to express their opinions or make motions related to the topic. Thank you. Do we have a second?
Heather Brissett seconds it.
Thank you. We will now vote on the motion to approve the minutes. All in favor, say aye. Aye. All opposed, say nay. Let the record show that the motion has passed. Clerk, is there anyone that submitted public comments for the meeting?
No public comments were received.
Thank you. Is there anybody in the room who would like to make comments? Public comment at this time? Perfect, thank you. The meeting is now open for new business. This morning, we would like to spend some time at the beginning of the meeting hearing about perspectives on the primary issues faced by women in relation to their health and well-being to help ground us in the work we are doing here today. Is there anybody who would like to start from our commission talking about either direct practice work that you have done or that your organizations have done, or if it's not direct practice work, other work that you have done in the community related to women's health?
Madam Chair. For the last 15 years, I've been.
Is your mic on, Mayor Thomas? I'm so sorry. Is the green light lit up? There you go. Thank you.
Sorry.
No worries.
Sorry. Mayor Thomas from Richmond Heights, Ohio. For the last 15 to probably 17 years, as a member of the Women's Caucus on the state level and the local level, we have been advocating for women. And it's important that we understand that in order for women to get the things and the services and the health care they deserve, we have to create policies. And so with that being said, my fight is always to ensure that we elect women to all three branches of government. And so I will continue to do that. I will not stop doing that because we have a lot of work to do. And we are at the beginning of that work. But I also want to just shout out and thank County Exec for just being there with us every step of the way. Understanding this is an uphill battle, we will continue to fight it together. And thank you again for creating this commission. And so that is what I do. Thank you.
Thank you so much, Mayor Thompson, for lifting up the importance of having women at all levels of government. Thank you so much. Is there someone who would like to share next? Don't all jump up and down at once, please.
I'll go. My name is Lauren Bean, Dr. Lauren Bean. I'm a pediatrician and one of the leaders of Ohio Physicians for Reproductive Rights. And so with the status of issue 1 that we all successfully voted for last year, I think everybody has heard that the 24-hour waiting period is now under temporary injunction, so it is no longer in effect. So people are able to get same-day abortions in Ohio now, which is awesome. And one less barrier to care. And then I also heard a rumor that the Hamilton County judge will likely issue a decision regarding the 6-week ban today. So it'll be interesting to see if that happens, and hopefully that will be good news.
In the area that Jasmine Long, the area that I'm more so focused in is infant mortality. And so we know that we have a major issue in Cuyahoga County in Northeast Ohio around infant mortality, primarily affecting African American moms and babies. We know that we have a lot of maternal mental health issue crises, as is evident as national information shows as well. We're going to be hearing from Enlightened Solutions are talking about them today. We know that Cleveland was rated the worst large metropolitan city for African American women to live, and healthcare was a major component of that. We see that there are still some families that have a lack of access to getting care. We see that there is a reduction for some reason in those who are receiving prenatal care. And so we have a lot of things that we can address around women's health in that issue. We know that there are issues that are impacting our elders as well. So as we think about the entire lifespan, there are things that are happening. We know that the 0 to 3 is critically important, so next to a pediatrician, to address as well. So there are so many different things that need to be addressed in our community, and they have to be addressed looking at both the social determinants of health or social drivers of health, how we want to call them, but also looking at the clinical as well. So we have to really address in a multifaceted approach to have some true change and impact.
Madam Chair, Emily Campbell from the Center for Community Solutions. I appreciate that Jasmine brought up health across the lifetime, because that is an area that we take a look at truly across the lifetime. And one of the things that we see in the data for Cuyahoga County is that unlike many counties, older adult women are less likely than their male counterparts to be up to date on their preventative care services. And so we know that there are lots of barriers that go into ensuring that women at any age receive the health services they need. And that's something that I'm hoping this commission can think about and take a look at. The other thing I'd like to mention is that Community Solutions compiles and produces an awful lot of data, and we're thrilled that next month we will be releasing fact sheets looking at health and well-being for every neighborhood in Cleveland, as well as every county council district here in Cuyahoga County. That I hope this updated information can help us look not just at the county and the health of women as a monolith, but start to think about where are the areas where we see disparities, where are the parts of the county where there are bright spots that we can learn from and adopt some of those solutions in other parts of the county that may be lagging behind, or where the health of people may be lagging behind. So happy to be part of this group and looking forward to the work that we'll do together, always remembering that at the bottom of all of these statistics are individual lives and individual people.
Madam Chair, can I just say one more thing? I promise I won't be long. As this body looks to create policies and initiatives for other women, I think it's crucial that we try to address the issues for this body so we can continue to have the strength to go out there and do great work. So as we fill others, who's going to fill us? Thank you.
Thank you, Mayor Thomas.
Hi, everybody. My name is Melanie Golumbieski. I'm a family physician. I'm also a preventive medicine and public health physician. I work at Neighborhood Family Practice. It's a federally qualified health center located on the near west side of Cleveland. I'm currently serving in the role of chief medical officer, and I've been there for 10 plus years through my training and my time working there. Federally qualified health centers are around due to federal funding, and our purpose is to be in places that are divested from of primary care. So our goal is always to look at neighborhoods, populations, and people that may not be getting service in a way that they deserve and to the full extent. So our services span from the whole lifespan. So we have midwives that help us to deliver healthy babies. We have family physicians that will see, and family nurse practitioners that will see patients throughout the course of their lifetime. And then really importantly is integrative behavioral health services. And so we have lots of experts around the table. And I think something that our line of work brings is really understanding and working to hit that connection between physical and mental health. And without mental health, you have nothing. And so that's a really strong proponent at our practice and ensuring access to mental health services. We also serve as the domestic medical exam screener for refugees that come into the county, into our county. So this year we're set to see about 1,000 new people that are coming from all places of the world and have been through very difficult times in their life, and we feel very honored to help them. Get settled into Cleveland, get the medical care that they need, and then kind of help them going forward. So we get to see quite a breadth of women from different places, different cultures, different languages, and their families as well.
I'll go next. My name is Connie Moreland, an OB-GYN physician from Metro Health. And I think I have a unique perspective in that I'm a recent addition to the Cleveland landscape. I moved here in January of 2024. And I'm here to do medical diversity and inclusivity work at Metro Health. And I'm also a practicing OB-GYN. I have about 30 years of practice experience, and I've had an opportunity to see women in, I guess, very well-off circumstances, and then also in the community, in the medically underserved neighborhoods primarily. And I would say that one of the things that we often hear women saying is that they have not been heard. And this is a recurring comment. And one thing that I did a lot of thinking about is women want to be heard, particularly Black women and other marginalized women, but they don't just want to be heard. They want us to hear. They want us to take the time to thoughtfully hear, and they want action. They want us to do something about their circumstance. One of the things that I also did a lot of thinking about is that how is it that providers can hear better? And one of the things that we need to do is to look at policy that allows us to have the time. We can't listen if we don't have the time. And we already know that many of our patients, especially in the county, they have high need. And if they have high need, then we need more time with those patients. And we also need to look at policy that allows the providers to receive greater compensation for that time or greater reimbursement for that time. So in short, I'm happy to be here. I hope that the years of service that I've had in the healthcare profession, primarily with women, can serve this commission well. I'm so happy to be here.
Good morning, everyone. My name is Heather Bursett, for those of you who may not know me, and I've worked several years in the social service field. I'm here today representing Murtis Taylor Human Services Systems, where we provide an array of services across the lifespan. So hearing my colleagues, talk about the different age span as it relates to the elderlies is important. I would also add the group that we have to keep in mind is our working mothers. It's very challenging for them, especially our individuals who are marginalized and don't have the economical needs to meet their every need. You know, they can't take time off work to take their children to see a medical doctor, or themselves take time away from work without being penalized. So, as always, I'm eager to be here and to contribute as much as I can to making a difference here in Cuyahoga County. Thank you.
Okay, I'll say one last thing, because you sparked it. Because we're talking a lot about policy, but I do want to note that, to your point, there's a group of us that are really working to get paid family leave passed. You know, we're looking at potentially doing a statewide ballot initiative to make that something that is available to families, because, to your point, that becomes critically important. Educating employers about breastfeeding and what is actually legal and illegal for them to do, and how to create safe spaces for moms to be able to even exist in the workplace is so important. And it's a major driver of stress. And when we look at toxic stress being a leading cause of maternal mortality, infant mortality, and a lot of the health issues, heart disease, things that are plaguing mothers and women across our county, I think that's so important. So thank you. I just wanted to build on that.
Let me just jump in there real quick too, since Jasmine and you made this point. One of my keen observations, especially since I've been here in Cleveland, is that childcare. I cannot tell you how many times I have seen women in the short 6 months that I've been here in Cleveland leave the hospital or refuse to stay in the hospital or decline to stay in the hospital. I like that word better, because they have childcare concerns. Your blood pressure is dangerously high. We are afraid for your safety, and you have to leave the hospital because you don't have childcare. And we also create childcare problems in the hospital. So a couple nights ago, I was sharing with Jasmine that one of her doulas was laboring a patient, and I asked the patient, what would be the perfect scenario for you to take care of your other couple children that you have at home? She had a 1- and 2-year-old child at home, and she was having her third baby. And she said, if they could be here with me. So, you know, we have to get creative in terms of providing child care. Why can't we have child care in our hospital systems for our mothers? I mean, to me, it's a natural solution. I mean, we have facility, we have professionals, we have, we can develop trusting relationships so that our women can receive the health care that they need.
Thank you. Would you like any comments or, okay.
No, not at this time.
Perfect. So I'm going to also come from the perspective of policy. I thought about medical school once upon a time, but I can't stand the thought of blood. So I went the other way and went to law school. So I'm going to come at it from a policy perspective as well. As many know, I lost my mom to domestic violence at the age of 1. According to the Ohio Incident-Based Reporting System, in 2022, there were 117,539 reported cases of domestic violence in the state of Ohio. 71% of these individuals were women. Approximately 83,452 women in Ohio faced domestic violence in 2022. It doesn't have to be this way, and we can do more, and we must do more. As a trustee member for the Shaker Heights Library, I helped highlight this issue of domestic violence, unwanted sexual contact, sex trafficking, and stalking. The library trustee then adopted a safe leave policy to help employees who face these tragic situations. Generally, safe leave policies provide time off for victims or specific family members of victims of domestic violence, unwanted sexual contact, sex trafficking, and stalking. This leave can be used to participate in safety planning, meeting with attorneys or prosecutors or other social service providers, filing a complaint with law enforcement, or enrolling children in new schools and safe environments. As a library trustee, this was one of my proudest moments. And as a commission, we can encourage local government entities, schools, nonprofit entities, and private entities in Cuyahoga County to adopt such policies for their workers. We can also provide model policy templates to aid them in the adoption of this policy and process. Under the leadership of many, such as Councilwoman Santana, who can't be here today, the City of Cleveland did adopt a safe leave policy for some of their employees. It is time for others to do the same to protect women and make an impact on women's health in this way. We can make an impact on the social drivers of health that disproportionately affect women. Thank you. Other comments of things that we are seeing, we will continue to have these discussions as we move forward and really talk about some of the direct practice care. And I really appreciate lifting up the specific examples of can we have childcare in our health organizations? And you know, so we will continue to have the conversations. Always appreciate Dr. Bean staying in the forefront of issue 1 because I know that is something that is so near and dear to many of us on the commission as well. So opening it up just for any additional comments at this time. Wonderful. Without seeing any, the next item on our agenda is discussion regarding the process for public comment for this committee. Proposed rules for public comment as well as a proposed form were provided to the commission for review. I now invite members to express their opinions or make motions related to this topic. And there is an additional copy in your packet today if you would like to review that for a moment.
Madam Chair, we're just going to be voting today to approve that this will be our process.
Correct.
Thank you.
Thank you.
Madam Chair, a question that most likely is appropriate for the clerk. How, if in any way, do these public comment rules differ from other public comment rules for county commissions and other bodies?
So these rules and this form were taken from another committee. It was utilized, they utilize it for the investment advisory committee. So since it's already been approved for use in another commission, we felt it would make sense to use for this group.
Or it states that the committee will provide a time at the beginning of the meeting for public comment. How much time? 3 minutes, 5 minutes, 10 minutes? How much time?
Traditionally, the county has had 3 minutes, is my understanding.
Okay, thank you.
Madam Chair, and then if we're doing the math, 3 minutes is on the form and up to 10 verbal comments would be a total of 30 minutes for public comment, but it states that written testimony can also always be submitted.
And does written testimony need to be submitted in person by the person wanting to comment, or can that be submitted through a different method?
I will verify, but I believe it can be sent via email to the clerk and the chair, but I will verify that and make sure it's recorded in the rules.
Thank you. Additional comments. I know this committee all shares the desire to make sure that our community is heard, and so this is a very important piece of the work of this committee. Any additional comments?
I think the point of my comment is just removing removing as many barriers as possible for people to be able to submit anything that they want heard or seen. And certainly coming in person to submit a form is a barrier for people.
Absolutely. Thank you so much. Do we have a motion to approve with our clerk checking on just how can they submit it? I agree 100%. It's hard to get downtown sometimes at 9 a.m. You know, on a work day, et cetera. And as we talk about removing barriers, I think that that's something that we would really want to consider to make sure individuals can submit comments in other methods.
Madam Chair, I make a motion to approve the public comment rules as written with the necessary changes as recommended.
Second.
Thank you. Any further discussion?
Madam Chair, I just want to say I appreciate that conversation, especially about openness and transparency and accepting different ways to get public comments, given people's time constraints. Did want to just mention that as we get those, I certainly want to encourage this commission to encourage our staff to get out and meet people where they're at with issues that are on their mind. So look forward to that, particularly organizations and individuals that are focused specifically on women's health. So direct us as needed. Thanks.
Thank you, Executive. Without any further questions or debate, we will now vote on the motion. All in favor, say aye. Aye. All opposed, say nay. Let the record show that the motion is passed. Thank you. The next item on our agenda is discussion regarding the open position of vice chair for this commission. I now invite members to nominate individuals for this position, and we will make necessary motions related to this topic. Good thing I'm off the hook now because I'm already chair.
Madam Chair, I would like to nominate Dr. Bean. She was very instrumental on the passage of Issue 1, and I am very confident that she will continue to lead and advocate for women. So I would really hope this body would accept the nomination of Dr. Bean. Thank you.
I second the nomination.
Thank you so very much. I'm very honored to be nominated. Before I accept, can I learn more about what that would require? I don't want to commit to something that I can't live up to.
No, it's all a surprise. And I'll call on my colleagues at the county who have been instrumental in supporting me thus far in the role as the chair. But generally speaking, we will have a meeting that can be set around our schedules. They have been very flexible, understanding employment, our health issues, our raising families, obligations, personal obligations, to basically keep moving the commission forward. Helping set agendas for the commission has really been the main role, but I'm gonna also call on my colleagues.
Yeah, I think the primary role of the vice chair is to serve as an alternate if in the situation where a chair may not be present. So it's really to kind of support that to Neil and that role.
I need a lot of support too, just like want to be upfront and honest here.
I appreciate that. I would be honored to support Councilwoman Tennille as the vice chair, but as a vice chair, I would also need a lot of support. So just full disclosure, this is not my comfort zone, so thank you.
And Dr. Bean, I want you to know that we're here to support you, so you'll have all the support that you need.
Wonderful, thank you.
I'd second Heather's last comment, and also just want to say to Mayor Thomas's comment, we did get to know Dr. Bean a lot on the Issue 1 campaign, and I appreciated the fact that as you advocate, you educate, and the education of people about what was in front of us. I think frankly, voters were better off for your presence wherever you were, and I was with you at a lot of those events. So thank you, and I think you're a great educator as well as an advocate and a medical professional. So I third the motion.
Thank you, Executive.
And I appreciate that. And I will just add, you know, I am only as capable as the team that I'm on. So this is a wonderful team, and I am truly honored. So thank you.
Wonderful. Further discussion in terms of nominations. I would be very excited also to work with Dr. Bain. I think it would be fabulous. Thank you. So, yes, can I have a motion, please? I'm sorry, I lost my place on my script. Thank you. Thank you.
Second.
Perfect. We could just do all in favor? I don't need a one. Perfect. Thank you. We will now vote on the motion. All in favor, say aye.
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 All opposed, say nay. Let the record show the motion has passed, and I'm so pleased. Dr. Bain will be in contact. Thank you so much for your willingness to serve.
Thank you.
The next item on our agenda is the discussion regarding the state's women's health proposal presented by Community Solutions. I now invite Emily Campbell, from the Center for Community Solutions to discuss the proposal.
Thank you, Madam Chair, and good morning again, everyone. Happy to be here. What I'd like to do is give a little bit of background about how this proposal came about, and then shift to talk about what we're hoping to do and why we feel that this is important to help propel the work of this group in particular forward. Almost immediately after the Supreme Court issued the Dobbs decision, Cuyahoga County acted very quickly to ensure that women in Cuyahoga County and others would have a wide range of reproductive health services and that could be protected. And in doing that, Cuyahoga County provided a grant to the Center for Community Solutions with the original purpose to help women in Cuyahoga County have access to a wide range of reproductive health services. As we know, things have changed in Ohio since that time, and the passage of Issue 1 meant that the landscape of reproductive health services in our state is substantially different than it was at the time when this grant was initially made. Now, as some of my predecessors at Community Solutions have said, policy isn't static, it can always change. And so, in May, when we made this proposal, our initial thought was to work closely with this commission to repurpose those funds for other purposes, perhaps be more forward-looking. And in order to do that, to determine what are some of the needs in Cuyahoga County, what are the buckets of issues that this grant may have the opportunity to address in our community, the Center for Community Solutions proposed compiling an assessment of a wide array of data and information on women's health. We all bring our individual experiences, we bring the information and knowledge from, at times, our professional background, but to look at a more global scale and to pull together the disparate pieces of data and information that are there. We also have an amazing opportunity in our community to weave in not just the numbers, but also the stories from women, and especially women of color. And you will note in the proposal that part of this is to partner with Enlightened Solutions, and we have Enlightened Solutions here today that are able to speak or answer questions should the commission have any. But Enlightened Solutions is analyzing the information that they collected through the Project Noir initiative that specifically looks at the experience of Black women in our community. And my understanding is that through that information that they've gathered, it starts to get at the issues that were brought up in the earlier discussion about women feeling that they haven't been heard, the specific issues that get beyond perhaps the clinical issues that prevent people from having the best health that they could, and suggest some of the interventions and actions that might be able to be taken in order to address those issues. So going beyond the numbers to get to the nuance and the experience, I think this is so important as we consider what can we do to make a difference in these particular issues. So what the Center for Community Solutions has proposed here is to utilize a small portion of this rather large grant from the county, this amazing investment that the county has made to propel women's health, in order to complete a State of Women's Health report specifically for this body. Our proposal is updated a little. As you know, this was sent back in May. We're now here at the end of August. And our recommendation is to present that report at the next meeting of this body in November. Part of our thinking in this, in speaking to the great support at Cuyahoga County, to our partners at Enlightened Solutions and others, is that we know that something important is going to happen the first week in November in the election. We have an election. We also know that, to put it in the most gentle terms possible, the two candidates for president have very differing platforms in terms of policies related to reproductive health. And so what we would also like to do is, at that meeting, hopefully we will have a sense of who will be our next president by that time. Gosh, I hope so. Is to also discuss whether those funds should be repurposed or if they should be held, depending on the policy landscape, that we can look into the crystal ball and think about the possibilities for women's reproductive health, as that was the original intent of these dollars. So, with all that said, the other change that I would like to suggest to this particular proposal is that as time has gone on, we have found that the information that Better Health Partnership was planning to provide should be publicly available, and we won't need them. We will be able to get it from other sources. And so we'd like to propose taking the resources that we were originally planning to speed that process up for Better Health Partnership, and apply it to additional resources to pull in more of the Project Noir information and to provide support for their staff to be able to analyze and examine information collected through Project Noir that they have not been able to and will not be included in the public release of that information as it relates to women's health, and especially as it relates to some of the barriers. And so I'm thrilled to have the opportunity to dig into these issues, to really pull together some evidence, and to provide a decision support document for this body to consider what can we do, with the assumption that what this body identifies as the highest priorities for addressing women's health that come out of an examination of this information, that we will be able to guide some dollars very quickly to address those issues within our community. That's part of, frankly, the benefit of the dollars sitting at a 501c3 nonprofit rather than a public body, means that we are able to deploy those dollars very quickly should needs arise or should decisions be made. So I am happy to entertain any questions, would be glad to also encourage folks, if you'd like to hear from Enlightened Solutions, please feel welcome to ask them, and would appreciate your agreement to this proposal.
Thank you. And if we could hear from Enlightened Solutions before we get into period for questions and comments, we appreciate that. Thank you.
There we go. Good morning. Thank you for having us here.
Good morning. Thank you.
And if you just want to give us a bit of an overview of Project Noir, just in case people are not familiar, my understanding is that we're on our second round with the project. But if you can just take us through and just give us a little bit of an overview of how it came about and what exactly that is.
Sure. We're looking at each other because we'll start saying the same thing at the same time. Well, thank you so much. Chi-Chi and I Founded Enlightened Solutions in 2018, and in 2020, Cleveland was ranked the worst place in America for Black women. And this was in terms of healthcare, workplaces, and education. So in response, we had a lot of conversations about, how we can support women in this region. But one of the things that we kept hearing was, we know there's a problem, but we don't know necessarily what it looks like on the interpersonal level. Do you want to add?
Specifically, we wanted to understand the tones and textures of understanding what racism and misogyny looks like in all three of these systems. We know it exists. We don't need to study it again. What we need to do is to create policy interventions to actually stem the tide. We see this as a purely economic reason. This is a purely economic argument that we're making, that Cleveland, being ranked the worst region in America for Black women, completely and totally shifts what we're looking at as it relates to economic stability. If individuals are birthing the next generation, rearing the next generation of Clevelanders, and they are not having solid healthcare outcomes, solid workplace outcomes, our region is worse off for it. So in 2020, we decided to create a survey. We thought maybe 20, 25 people would take it. The survey went nationwide, and we were able to receive over 450. Now in 2024, doing a second pass at this survey, we were able to triple our response rate to 1,324 Black women in Northeast Ohio, all across Cuyahoga County, even spanning to Lorain, Youngstown, Akron, and Canton. We're really excited about the publication of these results, mainly because we're really interested in hearing what Black women are seeing within these systems and how best we're able to learn from their experiences and shift the narrative around what it is to be a Black woman in Northeast Ohio. And I know that we absolutely have the power to change the narrative here, utilizing policy interventions.
I just want to thank you both for your work and to throw my full support behind this. I think data should drive decision-making, and to be able to have a true tool that is looking at both the lived experience through storytelling, but also through looking at the data is critically important when we think about how to have solutions that have a true impact. So just want to say I'm in full support. Thank you all for your work. It's not easy getting people to do these surveys and so forth, and it is even stories once or twice, and so to not have to repeat that by collecting new data, I think is absolutely incredible. So thank you.
Is it feasible for me to see the survey that was issued? I don't think I'm familiar with it.
Absolutely, yeah. We do have, we can provide a PDF copy of the questions that were asked. We're very close to publication of the results for our second survey. So not only have we remeasured a lot of what we measured the first time, but we've added a bunch of measures that the community asked for. So the way that our survey design works is that we ask about specific microaggressions and behaviors, and then we ask open-ended questions. And in those open-ended questions, we identify the stories that all have similar themes. And when we see major themes, we go back and ask that question again. So this time around, we have community-informed data points that we're really excited to report on, a lot more texture, a lot more depth. And then we've also asked those open-ended questions and identified even more themes, right? So every time we do this, we have more questions and more understanding of what the barriers are that women are facing in our region.
I have a question for the two of you, and then I have one for Emily. Are you seeing, just from your initial survey results, one, trends, and then two, have you developed kind of from the low-hanging fruit, the first observations, policy recommendations already, any that would pertain to Cuyahoga County?
We have so many.
Okay, maybe the highlights.
We'll give the highlights.
Yeah.
Absolutely. So in terms of recommendations, our work really focuses on the interpersonal barriers, right? So we have a lot of thoughts on how systems can integrate and hold folks accountable for providing equitable care, culturally competent care. So to the points being made today, one of the major themes that we've identified is not being heard, right? So 35% of our participants have had the experience of being told that their health issues aren't real or that they're made up, right? A major theme that was identified this time around and we'll be reporting on is a lack of bedside manner, right? So getting really bad news and then being told, why are you crying, right? We have a lot of stories around those pieces. For us, we understand a lot of the conversation has focused on kind of understanding the problem, right? Do we have a problem? What does it look like? For Chi-Chi and I, we're really looking at how do we remediate the problem, right? Policies don't walk into a room and discriminate, people do. So there are ideas around, tying outcomes to, doctors' pay, to their ability to progress within the organization, integrating some of our questions into patient feedback surveys. Those are things that we've talked about. Public data disclosures, right, on the outcomes between certain groups would be very helpful whenever women are trying to decide who to see, what doctor to see. What do those outcomes look like? What do they look like on an institutional level? What does infant mortality look like on an institutional level? What does maternal mortality look like on an institutional level? Those are off the top of my head. I think we have probably 50 more, so.
That's just for healthcare.
Well, thank you. I applaud you for the work you're doing every day. And then I just wanted to ask Emily, you guys are in this space too as one of the, contract agents overseeing work. Just how does your role play into this at Center for Community Solutions?
Yes, thank you for that question, County Executive. So the Center for Community Solutions is not involved in the Project Noir work. What we are hoping to do with this is to bring Project Noir into different spaces. And so in particular to this particular proposal, Community Solutions would be compiling the publicly available and other data that we have access to, and then weaving in the Project Noir pieces of it. So, having the opportunity for that data to be used in ways that was not necessarily anticipated when Enlightened Solutions embarked on this journey. But Community Solutions is not involved in Project Noir. Very supportive, absolutely supportive. But
One of our first supporters.
Actually, yeah.
Can I ask a silly question? When you say systems, like systems working together, working with the systems, are you talking about healthcare systems, government programs? Like what kinds of systems?
We utilize the word systems to really represent all kinds of systems. So we can talk about industries, we can talk about, in workplaces, we can talk about the corporate arena, you can talk about nonprofits. We utilize the word systems just to illustrate that they are interdependent on each other, and one decision influences the other decision. So for this specific body, we'll be talking about the healthcare system, but healthcare system also embodies the education system. It also embodies the workplace. So we're trying to literally illustrate how interdependent and how interwoven these systems are with each other, and making sure that all individuals are represented.
That's helpful, thank you.
And then it sounds like with the work of Community Solutions, we'll be seeing other data around chronic disease, access to healthy food, safety of neighborhoods, and things like that. Is that correct?
that is exactly right. Yes, thank you. Thank you for bringing that up. Some of the other data sources that we are pulling in is data related to birth outcomes, to experience of birthing people that come through data that's collected at the state level, and also Community Solutions has access to the full birth record database at the state of Ohio, so we'll be looking at some of that data. Other things that have been collected and compiled and come out through community health needs assessments, through other publicly available data sources, including information from the CDC, which can be broken down by smaller geographies, which allows us to see some of the differences. Of course, the Center for Community Solutions always compiles census data information so that we know how many women we're talking about in different categories and the kind of demographics. And then also we are hoping to bring in some mapping. So to be able to share on the screen maps of Cuyahoga County to see where there may be concentrations of different chronic diseases, of issues. One of the things that the CDC data asks and provides are the share of the population broken down by gender who have experienced at least 14 poor mental health days or poor physical health days in the last month. And looking at that map gives us a sense and gives us some confirmation of what we often believe to be true, but also highlights some surprises in areas that perhaps we wouldn't think of, where there may be some issues that are more hidden or that may be emerging. So what Community Solutions will be doing is pulling all of this information together to present it in a cohesive and digestible report and presentation for this body, likely at our next meeting. And I would hope spending a lot of time at our next meeting digesting and digging through that information.
Madam Chair, I'm leaping out of my seat on that because I think from your research and uploading and findings and recommendations to being able to actually map some areas of, gap in social determinants of health, and just obviously there's things that are more macro and universal, but there are things that we can at the county, dig right in and target. And I did want to say, even not to get too nerdy about this, but our geographic information systems team is eager to help us help policymakers. I'm looking at Mayor Thomas because we want to be able to go into a city like Richmond Heights with Mayor Thomas and say, here's some areas of real focus for issues, and obviously your team helps determine those. I'm just using it as an example, but this would be a very helpful tool to our overall Healthy Cuyahoga initiative
Yes.
to be able to geographically depict areas of concentration where we can apply funds, policy, and other things. And I know some things are more macro and universal, and like you said, some things might surprise people, but yeah, the data tool to us would be invaluable. So.
Just in terms of the actual survey, was it, I assume it was 18 and over, no minors?
Yes, yeah. We had folks as young as 18, and we had folks well over 65. So we had nice representation. Although our biggest groups tend to be between about 29 and about 49. So kind of those core working years, the years where maybe you're, creating your family or you're doing elder care. So we get a lot of responses from folks in those areas.
Now, another question, how were the surveys, how was the survey distributed?
Survey distribution is my jam. I love doing this. We opted for a completely digital survey, but also we held multiple events in person. In fact, we held an event with the United Black Fund at the Midtown Tech Hive where we had Black women come in from as far as Akron, Canton, to come in and take the survey together with each other, making sure that individuals that there's a digital divide or a lack of internet access also had the ability to take the survey. We understand that paper surveys, sometimes individuals will not fill them all the way out. We really wanted to stay close to the fidelity of keeping everything together, giving individuals access, digital access, and literacy around taking the survey, completing the survey, and then submitting it together.
How many surveys did you actually send out?
A lot. The response rate was 1,324, but we worked with well over 100 different community partners and individuals, including historically Black sororities, CDCs, government entities to push the survey out. We also utilized the power of social media to push the survey out. QR codes, I flyered absolutely everywhere just to make sure that individuals would be able to take the survey. So.
Apologize. I could go on about the mechanics of this, but it's exciting. We're in an era where we're trying to create what we call geographically informed government. So as citizens have access to data, nonprofits do, anybody who's looking at people in place in the cross-section of social determinants. I was curious kind of, and obviously if county becomes kind of the ultimate client, then by way of the nature of our government we serve, it's transparent data, open to all. But have you, one, thought about sort of open sourcing, and two, how do you update and maybe measure as you go whether we're progressing or not?
Sure. So in terms of public access or open source, we have a lot of considerations in terms of confidentiality that we have to think about. So a lot of our data is, we do both quantitative and qualitative. Quantitative, a little easier to make available and transparent. Qualitative, very sticky, right? And we promise folks confidentiality. So the quotes that you see from our work, oftentimes we're sanitizing those quotes, we're rephrasing those quotes because there's maybe named entities or there's identifying information. And we want to make sure that folks, we're protecting our participants, but also we're framing this in a way where we can have a productive conversation with the systems in the region. So definitely not against something like an open source project, but with the caveat that we're very sensitive to the confidentiality component. And I'm sorry, what was the second part of your question?
Updating, measuring how we're going and the ability to have that
Yeah,
data
so
be
something
updated.
we'd really like to do there is, right now, the survey is a huge undertaking for us. It's a big fundraising piece. It's the two of us along with several consultants, one right here in the back, we're very proud of. And so for us, it's a large undertaking. What we would really like to do in the future is utilize our survey tools to overlay data with existing programs. So finding the right places where we can put these types of questions. So when I said, embedding our questions into patient surveys and feedback forms, that's part of what we're thinking. Because if we were doing that, we would be able to release a report every year. That would be our goal, right? To have it overlaid with existing programs and structures. So it's something that we're exploring, but of course is an area where we would need to source additional funding and have the right partners and put it in the right place.
So just pausing here to see if there's additional questions and comments. And thank you so much for coming in and sharing. This has been, I have followed Project Noor, but it's been even very helpful for me to have some depth, a little bit more depth than I was not aware of. So thank you so much.
Thank you.
Without seeing any additional comments by the body, do we have a motion to, what we're trying to do is approve the amount to undertake the research, which I believe is going through. Our Center for Community Solutions is holding the funds.
Correct, to utilize the funds in this way.
Absolutely.
Madam Chair, I'll make a motion to approve the funds for Nora, for Project Nora.
Perfect, thank you, Mayor Thomas. Do we have a second?
I'll second. Lauren Bean. Thank you.
Thank you, Dr. Bean. Sorry. We'll now vote on the motion if there's no additional comments or concerns. All in favor, say aye.
Aye.
All opposed, say nay.
I'd like to abstain as I am employed by the Center for Community Solutions.
Thank you, and my apologies for not calling for any
No,
abstentions. Okay. Let the record show that the motion has passed, and we look forward to the forthcoming information and really being guided by data as we move forward as a commission. So thank you very much.
Thank you.
So for the commission's awareness, funding has been awarded to the commission in the amount of $475,000. At the November meeting, we'll have a comprehensive discussion about the use of those funds. We have obviously already decided to use those funds, but I think as we get some of those funds, as we get the data in from Project Noor and Community Solutions, it will help guide us in making further determinations and decisions about funding. So I really appreciate that. Are there any announcements to be made before the commission this morning by members? Okay.
I have an announcement.
Yes, please.
Jasmine had to step out. But First Year Cleveland will be previewing Toxic, A Black Woman's Story. Many of you, your hospital systems did partner with First Year Cleveland. It was a project near and dear to my heart as it came out of my committee for pregnancy and infant loss. 5 years to date and 150 purchases across the country. This film has been used in community-based organizations, hospitals, as a training around listening to women and all those things and social determinants, all wrapped up in a 26-minute film. With that film, we were proud to partner with National Geographic on the study guide, the actual discussion guide, which is just as riveting as the film. So on September 25th at Severance Hall, and I can make sure that the clerk sends it out, there's a link to register free of charge at Severance Hall on September 25th at 5 p.m. It starts, and there will be a panel discussion 5 years later, what has occurred, but you get the preview, 150 organizations across the country. And the latest, New York reached out to us to talk about how did we put something like this together. It's been such an impact across the country. So we'll make sure we have that in your packet going out.
Thank you so much, and I know those who are able to will definitely attend and support, but also attend and learn. Thank you so much. Other comments or announcements about things going on in the community or things related to the commission? Thank you. The next meeting of the Cuyahoga County Women's Health Commission will be held on Thursday, November 21st at 9 a.m. We've already had a prime and pumped the agenda here for hearing for some of the data coming forth, and so that will be a large piece of that agenda. And we also talked about discussing funding, so please mark your calendars, and we're excited to see everybody back at that time. Thank you, everyone, for sharing your time with us today. I think it's safe to say we are all excited about the important work that this group is embarking on and the information we will gain from the proposal to inform our work going forward. May I please have a motion to adjourn the meeting? And I would like to say for the record, it's just we're early, so that always helps women's health when you give people their time back, I think. So can I have a motion to adjourn?
So move.
Thank you. Can I have a second?
Second.
All in favor?
Aye.
Opposed? Let the record show the motion is passed and the meeting was adjourned. Thank you.
Thank you.